All right, good afternoon, everyone. My name is Shakeil Jones, and I'm coming to you live from Tallahassee, Florida. And this is Bago Banta, episode 2. I just want to say thank you guys for coming on here every week and supporting. I know we are only on our second episode, but the love and the support that I'm getting from each and every one of you is very much encouraging, and I want to just say thank you. So today our topic for discussion in Bago Banta is public health, a matter of importance. And public health is the thing that really allowed me to start the topic. It is to start Bago Banta. It is what made me realize that we were not informed, and made me really wanted to do something to really spark the interest of Tobagonians, and find a way or an avenue to get people more involved in island issues as it pertains to development. So, I have a lovely co-host coming on to the show today, someone that is very much experienced in this field. Her name is Dr. Faith B.Yisrael, and she would be joining me just a little time from now to, really touch on the issue of public health. Again, during the duration of the live, you are free to share your thoughts by commenting, and we are going to make time available to really entertain the thoughts of our viewers and see if we could address some of that and have the discussion also framed around that. What we're going to be looking at today is, what is public health, why public health, public health policy and its importance, government action and reaction, and the public health infrastructure. So as we get into the topic, I just want to provide persons with an understanding as to what public health is, because when I was looking at the lives from the Ministry of Health, where they will be giving the press briefings about the coronavirus, I realized that firstly, a lot of people do not understand what is public health. And we sometimes confuse that with clinical health, but there's a big difference between the two. So public health is the health of population as a whole, especially on the subject of government regulation and support. It has a lot to do with disease prevention, epidemiology, research, and policy. So basically, public health really deals with addressing the health issues of a population, whereas clinical health deals with the health issues of the individual. Now, don't get me wrong, these could sometimes, they're correlated, very much so, because who makes up the population? The people, right? But in the way in which they are studied and the way in which the both fields operate, there's a clear distinction between the both of them. And what I was realizing from these press and media briefings by the Ministry of Health is that there is a lack of understanding by the people who are listening between the two. And then I've been looking further into the construction of our health sector in Trinidad and Tobago, but more so Tobago. And what I've been coming to realize is that there is the absence of a very prominent public health sector. And don't get me wrong, the infrastructure is there, a lot of things are there with regards to public health, but in terms of the enforcing of policies and these type of things to really help the island move forward in treating with an issue such as this one, coronavirus, a lot of things are missing. So I decided to really reach out to Dr. Faith B.Yisrael and invited her on the show today so that we could have a discussion about it. Again, she has a doctorate in public health, and she is more than qualified. She have been giving her weekly updates about the coronavirus and her thoughts. So I would now invite Dr. Faith B.Yisrael, if she would go ahead to send me the request so that I can add her. Okay, we tested this out earlier. I'm seeing you, but I'm not able to add you to the live, Dr. Israel. Okay, guys, bear with me. Give me a minute. As I said, let me just recap for those that are now joining us. We are going to be talking about public health today and public health infrastructure, public health policy as it relates to Tobago and, what we, yes, to, really help better the situation that we're experiencing on the island of Tobago. Hi, good afternoon, Dr. Israel, and thank you for joining us. How are you today?
I am wonderful, Shakeil. Thank you. Thank you so much for this opportunity to have a discussion about public health. Thank you.
Right. So just for the viewers, can you go ahead and just tell them a little bit about yourself, what you're doing, what is your background, so that people, are, I guess, knowledgeable about you and that you're qualified to talk about the things that you're talking about, because it's really like a very important topic. It's very timely and relevant, given the situation that the world is going through at this current time.
Okay, sure. I have a bachelor's degree in neuroscience, which is the study of the brain and the nervous system and so forth. I have both a master's and doctoral degree in behavioral and community health sciences from the University of Pittsburgh Graduate School of Public Health. Um, my focus at school was HIV, was one of, that was a health focus that I had while going to school. My dissertation is on HIV in Tobago and so forth. So all of this, everything, I was telling somebody at the beginning of this COVID thing that I know the rest of the world is going crazy, and I know that we're so, we are surprised, and we are, we're not sure what to do. But this is exactly what I went to school for, and it was really fun thing. And I know that is an odd word, but you don't frequently get to see all of the things that you learn play out in such a large scale. And that is what is happening right now with the WHO and PAHO and the response to COVID-19 and so forth.
Right. So I attempted earlier to really outline to those that are watching that there's a clear difference between public health and clinical health. Because one of the things that I would have been observing is over the press briefings that a lot of people were misinterpreting the idea of public health and what that surrounds. So if
Right.
you don't mind, like just to provide further clarity and definition to that so that people could understand what is public health and how it differs from clinical health.
Sure. Well, public health, as you rightly said before I joined, public health deals with the health of the population, doing whatever we can to protect the health of the population, to get us, to prevent us from getting sick, and to get us well if we are sick. And I think Trinbagonians are already very familiar with what public health does, but we just don't really think about it, or we think that's all it is. When you think of the Department of Public Health in Tobago, for example, you think of the people who come and spray for mosquitoes. You
Right.
think of the people who come and pick up your garbage. You think of those people. And that is, in essence, what public health is, doing something not just for the benefit of the one person, which is what medicine is. You're working with the person sitting in front of the doctor, in front of the nurse. Public health works to ensure that the entire community gets taken care of. So that's why when you spray for mosquitoes, you spray the entire community so that everyone in the community would not get bitten by mosquitoes and would not get dengue and that kind of thing. So it's
Right.
something that we've been used to, but we had not thought about it the way it is being done right now as it relates to COVID.
Right. So I just want to get straight into the whole idea of the discussion, and because I'm very, very much excited. So today I really want to touch on ideas surrounding the public health infrastructure in Tobago. I want to touch on things like public health policy, um, the ability of action and reaction by, you know, any government in particular with regards to any sort of public health issue that a country may face. Right now we're going through the whole COVID issue again, so I felt like that was timely. So
Mm-hmm.
my first question is, how important is the need for an efficient public health infrastructure, and to what extent investment should be placed to develop this infrastructure?
Well, I think what COVID-19 is showing us is that the bedrock of the health of the nation sits within a well developed public health structure. And what we are seeing is because there has been such a focus on medicine in so many other countries where the focus was not on public health, you are seeing them falling down on their public health response when they would have normally done a wonderful job when it comes to the medical part of it. And I use the United States, for example. The United States is doing, and mind my French, a piss poor job at public health right now. And we usually think of the US as being on the top of the world and being first world and
Right.
so forth. But they are now recognizing that simple things like being able to do contact tracing is important. And they
Right.
did not really have the structure set up to do that kind of thing. Now, in
Mm-hmm.
Trinidad and Tobago, granted, we've done a pretty decent job, and I think our size certainly helps with that. The physical size, but also the fact that we are still very much a close knit kind of community where, I'm sure I could go to Crown Point and say, hey, Shakeil, and somebody in Crown Point is going to
To
say,
say,
yes, I know Shakeil. So because we've had that kind of culture, we are able to do a sort of a better job at the different aspects of public health that are important. But yes, having a structure, having a well outlined system. For example, we have in Trinidad and Tobago our county medical officers of health office.
mm-hmm.
And before COVID, I am sure no one even knew that that job existed.
Right.
But those people have become the bedrock. Those people are the ones who are really managing this entire response in Trinidad and Tobago. And it's because we have had those people sitting there doing what they've been doing all this time that we did not pay attention to. It's why we were able to respond so quickly in Trinidad and Tobago to this.
So, like, I'm listening to the things that you're saying and with regards to infrastructure, but one of the things that keep coming up for me, ideally, is the investment in research. And, I was saying to myself, that is where, when we have these pandemics, and, it's new for everybody, but I have been noticing that a lot of the countries in the Western world have been really investing a lot of time in research. And though Trinidad and Tobago have been, really putting the best foot forward and handling this situation in the best way that they can, I wondered if within our departments here in public health, if we have anybody doing, or spending that time on doing research so that we could gather our own independent
Yeah.
information. Because when I look at it, I'm seeing where, most of the things that is being required or said by the CDC or the World Health Organization is what we're adopting. And it's not that that is wrong or that it's bad, but where is our investment in terms of researching and understanding this virus for ourselves? So apart from, so that we'll be able to further enforce, measures that could help us to continue or better be prepared for any future instances of another pandemic, that type of thing. So it's
Right.
like, what are we doing in terms of research? Could you shed some light on that?
Well, I think you have touched on the one area that we are sorely deficient in. But I think that has to do more with our tertiary education system.
Right.
Um, in the United States, in Europe, all over, when you hear them talking about researchers doing this and that, they are almost 99% of the time linked to a tertiary institution.
Mm-hmm.
And I don't think our tertiary institutions in Trinidad and Tobago focus on research as much as the ones outside of Trinidad and Tobago. I have met lecturers who were almost upset that they had to come into the class and teach because their main aim of being at the university is to do research. They bring in money. I mean, becoming a tenured lecturer
Right.
has to do more with your ability to bring in research money and to do research than it is to your ability
Exactly.
to teach.
Yes. Yes.
So I think because our universities aren't there yet, that is why we are a little deficient in that aspect of public health. But I think this is giving us an opportunity to say, let's think about where we have fallen short, and then let us do something about that.
Yeah, and you could correct me if I'm wrong, but I am not aware as to if within our tertiary education system, if or institutions more so, if there are even programs that are solely geared towards public health. And, I attend Florida State University, and there's an entire public health department. And
Yeah.
since this situation would have come to the forefront, they have been utilizing the abilities and skills of the students that are part of that program to help with things like, contacting persons who would have tested positive. Some of them are
Right.
putting their epidemiology skills to the test and that sort of thing. So I really, really agree with you there in terms of, you know, setting it up from as early as within the education system so that persons are able to, interact with it from there. So in event going forward, something like this is to happen, we have the human capacity to, to really treat with the situation that may be faced before us. So my next question is it fair to say that public health policy can determine how effective a state reacts to a public health crisis? What are some of the driving forces to public health policy development? And what are some of the things that we ought to take into consideration when developing policy?
Well, the reality is policy should be data driven. Policy should be based on the information that is out there. And so there are several things. The data is absolutely necessary, but also the data may be going in one direction, but the objectives or the priorities of the government and so forth may be going in another direction.
Right,
So the policy should be based on these two things coming together and dovetailing with each other nicely. um, Policies that are not based in research tend to fall flat, and they tend to not be as effective as we would want them to be. And I would give a perfect example of what's, Tobago. I am sure you would recognize that Tobago per capita probably has the largest number of health facilities. Every village, every other village
right,
has a health center. Now, that technically is a public health policy. Let us build a health center in Pembroke. Let us build a health center in Mount St. George. That is a public health policy. And in many instances, I think that that policy came as a result of somebody saying to a politician, unfortunately, we want a health center in the village.
right,
And then they promised the health center. So in an effort to keep your promise, you build a health center. But was that the best use of the resources? The answer is probably no, because anyone knows that more than 50% of the time, when you go to these health centers, they are not open, or you can't find a doctor there, or you can't find the druggist, so you can't provide the service that the health center is supposed to provide 100% of the time. So yes, it was a policy. It was not based on real evidence, and because of that, we are seeing deficiencies in the execution of the policies.
right. Yeah, and it's funny that you mentioned health centers because I was really looking at that from the standpoint of infrastructure. And not the physical building, but the things that they're putting in place to treat with things like, disease prevention and stuff like that. And when I was like just zooming into Tobago, I was thinking about if it is in the creation of all these health centers, if they are truly fulfilling the purpose that they're there for. And I suddenly began to think about a situation where if it is that I am in Charlottesville and have to come down with something as simple as a appendix rupture, it
Yeah,
is simple, but it's also life costing, right?
exactly.
The length of time that I would have to wait on a ambulance to come to Charlottesville, then to take me back to Scarborough to treat with that, it could be a fatal situation. So what I was thinking is like about like within districts, we have Roxborough, we have Charlottesville, we have Northside. What about step down facilities?
Mm-hmm.
Step down facilities from hospitals. I think they have them in like Sandy Grande where it's possible to see a doctor and come do a surgery, that type of thing.
Right.
It's not a hospital, but in the event of some, grave emergency, we're able to deal with it there and then at that point in time and not have to go through that whole ordeal that we usually go through. So like that was one of the things or ideas that I had in terms of, bettering the structure of the public health system in Tobago. But
Mm-hmm.
I understand exactly what you're saying. Um, so, going into what is relevant, which is coronavirus, it is what everybody's talking about. And, funny enough, some people might say, oh gosh, we fed up here for this. But I think that is something that we as a people need to pay a lot of attention to because I still feel like
We
even
do.
though we are we're not increasing in our cases gravely, there are some things that the little things people are still not doing, and that could lead to some really, really bad situations in the future if we don't, do what is best and what is necessary. So,
Yes.
just on the idea of contact tracing, because you would have mentioned it earlier,
Mm-hmm.
how we explain the importance of contact tracing and identify what are some of the possible disadvantages experienced when conducting contact tracing, and how this can affect a community or population in a public health crisis.
Okay, so contact tracing is absolutely essential. What contact tracing is, very quickly, is identifying individuals. So you have somebody who you test positive for whatever it is. So it could be, in this case, COVID-19, but it is also used for other infectious diseases, HIV, and so forth. And what contact tracing is identifying other people who those people may have come into contact with, because simply being in their presence or having long term interaction with them
Hmm.
means you may also have the disease. And we've also recognized with COVID 19 that we don't know. Almost I think a year from now, we are going to all look back at ourselves and laugh hysterically, because
Right.
almost everything that we think we knew about COVID 19 a year from now, we're going to recognize we were so wrong about it. And one of the things is that we've also recognized that there are so many people who are asymptomatic, meaning they don't have COVID 19. They don't have symptoms, so they are not doing the coughing and the shortness of breath and so forth, but they may
Mm.
have COVID 19 and they can still pass it on to someone else. So
Right.
finding that person before that person then infects somebody else and then infects somebody else and then infects somebody else is absolutely critical. Again, because of Tobago's close knitness, we've actually done a decent job at that in Tobago with the few cases that we have. Now, of course, there are going to be issues relating to confidentiality and issues relating to, to my individual human right versus the right of the population. And
Right.
the thing with public health and public health laws, they tend to err on the side of not necessarily trying to take away your individual right, but understanding that the rights of everyone else, your actions should not put everybody else at risk. That is
Mm.
why we have like quarantine laws and so forth that says if you are sick and you have a disease that can be spread easily, we can physically move you and put you somewhere by yourself for the sake of everybody else who we are trying to protect. So when it comes to contact tracing and when it comes to establishing those kinds of laws that may infringe on individual rights, there is always a balancing act that needs to happen. But in those situations, when even you've gone to court, for example,
Right.
the courts usually err on the side of taking care of the community,
Exactly.
because that is a greater good compared to the one person losing their individual rights.
And because that would have been my next question. Where do we draw the line in terms of, like, you talk about the rights of the individual, but then we have a situation whereby it affects the community.
Yeah.
So how do we discern what needs to be done for the benefit of the community instead of the individual? And it's not because we're thinking of the individual as less or lesser important, but at the end of the day, we can't try to save one person and put the rest of the community at risk. So I clearly get that
Yeah. Yeah.
there. So, we've been talking about coronavirus, and, one of the things that is big out here in the US, everybody keep talking about it, is epidemiology, and the epidemiologists, what they're saying and what they're not saying, and the information that they have and they don't have. Um, to me, personally, I am no scientist, I am no public health official, I have no experience in this background, but I honestly believe that a lot of things are being missed in terms of the research that is being done to really find out how
Mm-hmm.
this virus is operating. We are a world of many different peoples. People are different, their body makeup is different. You have things like the environment to consider, and there has been little information on how they are taking these things into consideration. I know right now Trinidad and Tobago is in an uproar because our opposition leader, she made a joke about thanking the environment.
Right.
And it's not I mean, I guess the context in which it was used was probably funny, but it is something that is really a contributing factor to viruses and bacteria and how they function and how they operate. And I think, quite frankly, it is something that they would have overlooked in terms of, or they would not have really delved into, because they're so focused on finding a vaccine and finding a cure, but not
Right.
really trying to spend time to understand how the virus is operating. And to me, I think, like, when you have statistics about how many persons would have died, the age groups of these people, but I am wondering, like, with those records, what are you doing with them? From the time the person would have come into the hospital to the time that they would have died. How quick would that have
Right.
happened? Why would that have happened? And to me, I'm wondering, I don't know, I'm wondering if they are using this information to determine the length and breadth of this virus. But, my next question is, epidemiological, it's kind of lengthy, so bear with me.
Okay.
Epidemiological studies show that coronavirus acts as a lesser or in a lesser capacity in populations existing in warmer temperatures. In your professional opinion, when you look at the number of cases in Africa, Florida, and the Caribbean, how effective or factual is that conclusion? Do you think that the possibility of do you think that there's the possibility of missing variants to the study?
Okay, so let me go back by just defining what epidemiology is. Epidemiology is the study of the spread of disease. So,
Mm,
who gets a disease? Where is that disease? But it also includes the study of the factors that contribute to the spread of that disease. So,
right.
what makes it that that person got it versus that other person? So, that
Mhm.
really is what epidemiology is. Going back to the question about warm weather or not, the reality, as I said, a year from now, we are going to say so many things that we thought or did not think is going to change. We honestly don't know. Now,
No.
there are other things you need to consider. Now, there's this saying that if it isn't measured, it does not exist. So, is it that there are less cases in Africa, or is it that there's less testing in Africa? So
Mm,
when you look at the numbers, it may be much lower. But is it truly because we are testing the same amounts of people using the same kinds of tests and so forth right through the world so that we can compare that really right now? We don't know just yet. And that's the thing about COVID 19. There are so many things that we don't know. Yes, there are viruses that are more infectious during the winter, in the winter places and during the winter periods. That is why, for example, the flu season is really that cold period from
yes.
October, November until now, that
Yeah.
cold period. But again, because coronavirus is so new. Remember, we started off with this thing being called the novel coronavirus because we've had the coronaviruses forever and ever. But
Hmm.
this one seems to have mutated or seems to be so different from what was there before that we cannot say yet whether the same thing will apply with this virus versus all of the others. It's compared to, other STIs versus HIV. There are other STIs where we would say very quickly, well, yes, once you get it, you could get medication and then you're fine
Right.
and you're good to go. But when HIV came on the scene, we were like, oh, wait, hold up. This is very, 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 very different. You could
Mm,
have HIV, be taking medication, have sex with somebody else, and get another strain of HIV, and that
right.
was not happening with other viruses and that kind of thing. So I think it is too early to make any real predictions about what is happening with COVID 19 as it relates to weather. We need to wait until the summer months really come around to see if there is really a reduction in cases and to see if that really is a fact. We can't make any of those predictions in May. We simply can't.
We see. Okay, well, um, I mean, I get you there, but it's like, again, it's just because, I'm tuning in and I'm trying to listen because, I think I have an individual responsibility to myself to safeguard myself with regards to what is going on. And,
Mm-hmm.
like, when I listen, and I guess at this point in time, the US is probably not the best place to take
It's not.
examples from with regards to, but, it is where I am, and it is where where the information is being presented to me at this point in time. And,
Mm-hmm.
they really considered, again, the environment to be a factor because of the time in which the outbreak had happened in the US.
Right.
And to me, again, every part of the US don't experience the same type of weather.
Mm-hmm.
And then when you really look at the numbers in the north compared to the numbers in the south, there's a decrease. I could understand why they probably come up with that theory that
Right.
environmental factors have a part to play in it. But my thing is like, how are we, or how are they rather, using that information towards the research of coming up with the vaccine? You understand what I'm saying? So it's
Right.
like they're monitoring, yes, but there is no actual use of the information with regards to, because they're not coming and they're not saying to you, well, based on these factors, we realize that this is what is happening with the virus. Instead, the virus is just promoted as a death sentence. So, it just really goes to show to me, I think that there's a lot that is missing with regards to the research and the
There is.
investigation with regards to coronavirus. And it continues to put the world at stake.
Yeah.
And I understand that this is something that may take time to come up with, but at the same time, like, there is very little being done with respect to, like, when you look at the number of persons dying and the number of persons becoming infected, and then they're saying that there's going to be a second wave. Like, I feel like the pace in which you're trying to arrive at this information is very slow. And that's just like my honest view as a normal person in this situation. Um,
Well,
so,
but let me push back with that though. I don't think it is very slow because remember, we are only 4, 5, 6 months into this, and what they've actually been doing is fast tracking a lot of the things that would normally take years to do. So the fact that
mm,
they are promising us that by the end of the year we should get a vaccine, vaccines usually take 2 or 3 years to go through the process
oh,
to
okay,
get a vaccine. So, as a matter of fact, I am actually a little concerned that they're doing this too quickly.
right, right,
And they may then be putting people at additional risk after the fact when they realize, oh, we should have added 6.5 of this instead of 7, kind of
mm,
thing. But you
right,
only find out after the fact, after you've given the vaccine, after so many people have died because of the vaccine and not because of COVID-19 and that kind of thing. So it's a balancing act again. I said that we have to do, and we are getting there. Again, Trinidad and Tobago is really not doing any kind of research. We are now just being a part, for example. No, we are not. We have just signed on to being a part of a WHO research where they are looking, where WHO is pulling data from all of the countries about
mm,
what is working in terms of treatment and that kind of thing. As a matter of fact, let me just plug, just so you know, WHO just basically reported and said they have actually stopped using hydroxychloroquine because they've recognized just from Friday that it is really causing heart failure and it's causing more people with COVID 19 to die. And
oh.
they have that information because they are pulling data from all of the different countries where they are using different therapies and that kind of thing to see what works and to see what doesn't work.
So, like, when it comes to Tobago, because you're talking a lot about testing, and when it comes to Tobago, like, what are your thoughts on the effectiveness of testing in Tobago, and, like, how do you think, if it needs to be improved, how do you think that they could improve it?
So I've always said, and if you've heard me speak on a live since March, I have
Mm,
been saying that Tobago needs to do more testing because again, you need to test to know, and because we also know that there are people who may be asymptomatic. There were people. Now let me go back a little bit. The testing regimen that we were using in Trinidad and Tobago was based on the WHO case definitions, which means they were not for about a month and a half. They were refusing to test you, even if you had flu like symptoms, if you did not just travel from another country or if you did not come into contact with somebody who is confirmed, which means there may have been a whole lot of people on the island who did not travel and did not come into contact with some confirmed person who may have picked it up somewhere else. Remember, we had Carnival where so many people came into the country for Carnival. We are
Right.
learning from autopsies, well, not autopsies, from samples that they tested post of they're recognizing that there were cases of COVID-19 in the US even in December,
Mm.
and we've had people flying back and forth. So because we were using such such restrictions when it comes to who we test, I personally think that we probably missed a couple people. Now, thank God they've probably all gotten better. They've probably, because we live in this wonderful land, and we just drink with bush tea and all of these
Right,
other
because I
things.
was now about to talk about that because
Yeah,
I was even wondering because that was my thought about it, like how much people, apart from the fact that they need to do more testing on the island, and how the testing that is available there, I felt like that was a little poor, but you know
it was.
they want to do the should do more testing on the island. But I was saying, like, how honest are we within ourselves to go to testing? Because we are a very traditional society. We get a little cough, we get a little cold, a babasha, bushrum, or something, a dip in the sea is what would cause that. But it's really taking time to understand the severity of the virus, and
Right.
and making it our responsibility to ensure that we do contaminate others or infect others.
Mm-hmm.
Um, so the final question is, it is expected that there is going to be a second wave of the coronavirus, which is going to be during the hurricane season.
Mm.
Do you think that Trinidad and Tobago is prepared to treat with two issues at the same time? What will you suggest we do now as a nation to be proactive and ready?
So yes, there is going to be a second wave, because even though we may have contained whatever we had on the island, as soon as we start opening up our borders, we are going to get cases coming in. And depending on where those cases come from, we now have the United States being the capital of cases. All of us have aunts and uncles and friends and so forth in the US waiting to come home.
Right,
So we are going to have to deal with the second wave. The issue with dealing that would be, um, we would have to figure out, and I think to some degree Trinidad is ready. I am less confident that Tobago is ready to have the medical facilities to treat with the cases that need hospitalization, because
right,
only a small percentage would need hospitalization. But we already saw where our 100-bed hospital was basically turned up in array
right,
because of the one or two cases that we had. So we have to deal with that. um, Now, I also know one of the few state entities that I have quite a bit of faith in is actually our emergency response, TEMA. And I do know that TEMA has been working feverishly to prepare for hurricanes, which they've done quite a bit of before. And when you listen to the Minister of Health and to those other people, they are taking that into consideration, where they are identifying, for example, additional shelters. So
right.
we know that we tend to have the community centers and the schools and so forth as shelters, but they've been expanding those places so that if push comes to shove, we have more shelters to go to. Because the thing with COVID and shelters, shelters is a place you run to quickly, and it can quickly get quote unquote overcrowded. Crowding and COVID is a horrible
Right.
combination. So I think they've already started, and I have some faith in TEMA in Tobago to already start to prepare for that kind of thing. And to be honest, I mean, I know it's, as a public health professional, it's probably something I should not say, but we have been proving that God really is a Trinity.
I mean, I beg to differ, but okay. Everybody's entitled to their own opinion. I beg to differ, but okay.
Because when you really think about it, the number of cases that we should have had on those things, considering we had carnival, considering everything else that's happening. So, we have some kind of special blessing. And I am just also praying that that blessing continues during the hurricane season. Now, the good thing about where we are in terms of the hurricane belt is Trinidad and Tobago is actually right outside of where all of the horrible hurricanes pass. Because I don't know if you've really noticed, they
Yeah.
always go just a little above just a
Yeah.
little above us. So we really are blessed in that regard in terms of where our physical location is to not be hit with a lot of the hurricanes that are going to come through.
Right. I mean, I hear you, but to me, there are times where you do. Sometimes Tobago, we get the tail end of the thing,
Of the,
and it
yeah,
could be just as equally devastating as being hit directly, depending on the category of hurricane that it is.
yeah,
But my
that's
my
true.
question is, because I'm listening to you and you're saying that, you know, they're trying to expand the amount of shelters that they have so that they could really facilitate the whole idea of social and physical distancing within these things, or these shelters.
The
But
shelters.
I am wondering if there is going to be any sort of, you know, medical facility attached to these shelters in event that, you know, we have, or a possible case arise with that. And you know, during this period of the hurricane, you may not be able to take a person to a hospital or a health center. So are we looking at, you know, putting in place some sort of medical assistance, attaching them to these shelters in event of, because we can't just sit back and say, you know, we're blessed, because
Right.
time has proven, or previous instances have proven where Tobago would have been hit by tail ends of hurricanes. So I think we have to take into consideration the possibilities of, and looking at how we would treat with the situation in event of, and being proactive about that.
And I agree with you. And I think in terms of the policy of or the standard operating procedure for each of these shelters, it would have to be one that allows for um, one early detection of somebody who has COVID-19. And even though we may not be able to do the testing, although we do have a point of care testing machine, which is a little machine that you could just put on a desk and test. Um, Doing testing for temperature is actually a pretty effective way of
Mm,
determining whether somebody may actually be sick or not. So having a process where I know we are running and I know we are trying to get into shelter, but testing people's temperature early into before they can get into the shelter is one way of saying, okay, quickly, your temperature is too high, so we need to find somewhere else for you to go versus
mm,
coming into the shelter with other people who may have normal temperatures and that kind of thing. When it comes to the hospitalization of people who have COVID-19, though, we have to be careful because the people who need hospitalization, they do need things like ventilators and that kind of thing. And it may be worth having special centers throughout the island
right,
where we can get to there quickly instead of trying to have them commingle at the health center or at the hospital and that kind of thing.
right.
And that again is something that we've spoken about. That again is something that we have seen them do in, I don't know if you've looked at the tent hospitals, for example, in New York, where they
Mm.
basically just put up a tent and they
Outside.
have the bed outside, they have the bed, they have the ventilators, they have, you know, those things there. And by no means do you need any huge structure. You just need the facilities to have
to
certain key
to be
pieces
able
of
to.
equipment. Yeah.
Okay. Well, you know, it we have come to the end of today's banter. I really want to say thank you again for always, you know, supporting my initiatives, and, you know, just coming on the show and sharing your knowledge and sharing your experience with the Tobago public. One last thing I would like to ask, though, if you had the ability to do something to really develop the public health sector in Tobago, what would that be? Or like, what do you see the need being, and what would you do to fulfill that need?
Okay, so that is a pretty difficult question because there are so many things that I would like to do. But if you're talking about actual development and real development, I would actually focus on education. So having that University of Tobago where allied health is a part of the education, because again, going back to the whole idea of the research happening at universities, there are so many things that relate to Tobago's health that we need to study for ourselves. And when I say health, I don't necessarily mean just the treatment of the patient, but going back to things like really looking at fever grass. Fever grass may really be the cure for COVID-19, but we don't know. and
Right.
having an institution where we could do that kind of in-depth study of looking at what is in fever grass, what are the chemical compositions of fever grass, how can this then be used as real medicine and that kind of thing. I think that would benefit Tobago generally, not just the
Right.
public health part of it, but that would look at the educational part, that would look at the tourism part, that would look at so many aspects of development of the island of Tobago. And I think that is where we need to focus some of our attention, because that is what is missing right
And
now.
again, I certainly agree that education is ideally important with regards to the development of any health sector in any part of the world, because a lot could be found in research, and we're not doing that. We're not spending the time to invest in research to understand why, how it's affecting people within our population, like how the virus is operating. Because again, there are asymptomatic people. There are people who are getting it, and they don't experience the severity of the symptoms like other people will. People just
Right.
going through mild phases of this thing. It leaving
Exactly.
others quickly than it. So we really, I see the need for it. And even within the education infrastructure that we have now, I would recommend and advocate for, the creation of programs that is within the whole allied health faculty, so that people
Yeah.
could start getting the exposure and endeavor into studying it. Because I really wondered if we have anybody that could stand up and call themselves epidemiologists. No, and again, I think that, okay, we have the doctors, we have the nurses, and that they too would have a study and understanding of viruses and whatever, but do we have a human capacity whereby we could, say that this group of people is what is responsible for really
Yeah.
researching viruses, and in event of pandemics, we have somebody, at the click of a finger to go at it?
You could go
No,
to
we
them.
cannot.
No.
So I actually agree on the whole idea of having education at the forefront to treating with the issue of a proper public health system, not just in Tobago, but in Trinidad and Tobago. But again, Faith, I just want to say thank you again for coming in and sharing your views and sharing your thoughts and your expertise in this area. And again, thank you for supporting my initiatives always. It has been a pleasure having you. Thank you so much. um, Guys, again, I want to say thank you all too as well for joining in and for being here with me every week. um, Next week we're going to be talking about Next week, we're going to be talking about entrepreneurship and its potential to fuel the economy. And I have two lovely guests that would be on board to share with you their expertise on that. Again, I just want to say thank you. My name is Shakeil Jones, coming to you from Tallahassee, Florida, with me saying that she did her dissertation on virus
Viral
mutation.
mutation. Oh,
Oh,
wonderful.
exactly. So just thank you all. Continue to support, continue to share the live afterwards. I'm really doing this for the benefit of Tobagonians. And I just want to say thank you to everybody who continue to really support the initiative, continue to keep tuning in every week. And, thank you again. Thank you, thank you, thank you, thank you.